Hello and welcome. I'm Richard Crispin, CEO of Collaborate Up, and your moderator for today's discussion, Practical, Not Magical, Harm Reduction and Public Health. We're coming to you live from the studios of the Washington Times in beautiful downtown Washington, D.C. And we are so grateful to have this wonderful conversation today as we dive deeply into harm reduction. As human beings, we love to, when faced with a crisis, look for the boogeyman. Who is at fault? Find the magical solution, the magical silver bullet, and slay that boogeyman and move on. Unfortunately, in an ever more complex society, we have to look for more sophisticated approaches. And that's why harm reduction, first pioneered in the healthcare field, may offer some keys to how we can tackle really complex challenges from climate to COVID to crime. And we're going to get into that today in our discussion. I'm so grateful to be joined by a number of experts from around the world, including Dr. Imane Kendili, the co-director of the Harm Reduction Manifesto, Kai Young, a vice president from the Foundation for Climate Restoration, Lieutenant Diane Goldstein, the executive director of the Law Enforcement Action Partnership, and Mazen Saleh, the policy director for integrated harm reduction at the R Street Institute. Our conversation today is brought to us in collaboration between Collaborate Up and the Washington Times, with the generous support of Philip Morris International, R Street Institute, and many, many other partners, including Orion Media, MAPA, and Aphorosme. So we are so grateful. We're going to dive into this conversation. I do want to give a couple of instructions, though, if we can move to the next slide, please, to our participants. Because some of our conversation will be conducted in French, Dr. Kendili will be speaking in French. I ask all participants and panelists at this time to move to the English channel. Unless you speak French, I suggest moving to the English channel. You can do that by mousing down to the bottom of your screen. You'll see a little globe down there that says interpretation. You click on that globe and you can go into the English channel. I am now speaking to you in the English channel. If you couldn't hear me, you haven't gone into the English channel, please go into the English channel. Don't mute original audio. I suggest keeping that original audio. That way you can still hear all of us who are speaking in English. But again, please move into the English channel at this time. With that, I'm going to turn now to Dr. Kendili to give us some opening remarks on harm reduction and how it might benefit us as we think about these other more complex challenges. You can take down the slides. Thank you so much. Dr. Imane Kendili, you are a trained and certified psychiatrist. The president, you served as president of the Moroccan Association for Addictive Medicine and Associated Pathologies, and you are the co-director and co-author of the Harm Reduction Manifesto. Dr. Kendili, I've read the manifesto, and it looks to me like a really useful mindset for tackling numerous complex problems. But back us up for a second. Please explain for us what you and your co-authors mean by harm reduction, and give us a couple of examples of how it's working already in healthcare and public health. Dr. Kendili.
Merci beaucoup.
Thank you very much. I would like to thank everyone who's here in the room, and thank you for your introduction. Harm reduction is not anything new. Harm reduction is something that I've had the pleasure of working with way before MAPA, so the association, and I believe in it. It started with the STDs and injecting their users, and we're proud as Moroccans to have been able to set up, thanks to Professor Toufiq Jallal, who's part of the co-directors, and the care of heroin users based on harm reduction. Now, harm reduction is something which today, with the COVID-19 pandemic, is becoming a projection of public health policies that's necessary. What happened through this reflection is that we saw that with COVID-19, the harm reduction measures, or a global health policy with the pandemic based on harm reduction and wearing masks, social distancing, vaccination, lockdowns, which occurred in several countries. So all of these things are harm reduction measures. Of course, we can still catch COVID, but we prevent serious cases. And this has helped to set up and to think about this book with several sensitivities and several experts. And we thought, well, at the end of the day, Do we need to have the largest number of respirators possible, the largest number of physicians or nurses, etc., and equipment, infrastructure? Or can each citizen be a patient and a citizen? And so everyone is an actor in their own health, just as we saw by going through the maturity of the populations through COVID-19. Now, starting from this point of view, we talk about behaviors independently of behaviors and addictions and substances that we can use, or the lifestyle. And when we talk about lifestyle, we can talk about several things: consumption of sugar, junk food, risks of obesity, of diabetes, behavior related to the environment, to the ecology, waste management, etc. And where we stand with respect to these things, we might be quite late, but we thought together and we thought, at the end of the day, there isn't a health of countries of the global south and countries of the global north. There's a global health which involves society, which involves medical, non-medical, civil society, and which involves the individual within the community that needs to protect themselves and protect others to not reach cumbersome healthcare and not to have chronic diseases from a health point of view, and to not end up with pandemics or a non-consideration of the environment. And so all of these things have been thought about with different people from different countries across several continents in order to unify an expert thinking around a concept, which is harm reduction, and which is a concept that's even more important in a continent like Africa that doesn't have the same resources as other more developed countries or other continents. And there's an economic harm reduction as well that can be costly from a human point of view, and they can be costly from an economic point of view for countries that don't necessarily have the right budgets for healthcare
and sexually transmitted diseases, and that COVID showed us how harm reduction can inform and influence global and national public health policies. And that really what we're talking about here is looking at how do we manage issues that are not necessarily in crisis mode, but also might become more endemic or inherent to the human condition.
Go from the principle that humans will have a response, an all or nothing response to their health. The issue with medical and healthcare decision makers is that we talk about all or nothing. This is good for your health, this is not good for your health. However, the human beings are great in the sense that they're miserable. They have pleasure, they have desires, they have behaviors that can be harmful to their health. Now, if we can't have a human being that's perfect, and we saw the prohibition and things that are forbidden, and when we try to impose things, it doesn't work, and people go against that. So we can say, don't consume too much sugar because there's diabetes, etc. Obesity is bad for you. It's good to exercise, but that doesn't mean that human beings in general will do the right things and apply them. And therefore, if we need to have a responsible and accountable human being, we need to make them accountable for their health. So it's not the all or nothing approach, so that we don't lose patients when we're doctors and we're oncologists, for example, and at the same time, we can educate for a better health and harm reduction from a very young age to have less impact in terms of chronic diseases. There's no magic, there's no silver bullet in health. The WHO for 2025 said that the two serial killers are sugar and tobacco. And so today, if we talk about non-transmissible diseases like cardiovascular, diabetes, cancer, etc. And if we talk about behavior, because I need to mention environment, behavior, etc., harm reduction measures go through very different things. It's not only the medical field. Health is something that includes a lot of things. There's this social aspect, there's unemployment, which is also a factor of good health. And so This means that if we look at a vision of public health policy that's adapted to the human being in harm reduction, and I'm talking about a third pathway, i.e., we need the right balance between the all and the nothing. And so we need to adapt to patients and make them accountable. We need to involve them and empower them in their health. That's why I'm talking about the concept of citizen patient. And we're talking about a maturity of populations by involving them, by informing them, by raising their awareness, especially since healthcare budgets are among the highest among the different governments in the world.
Perfect. Thank you, Dr. Kendili. I know, Kai, you are the Vice President for Partnerships and Development at the Foundation for Climate Research, a leading nonprofit working to restore our climate to pre-industrial levels. You've heard Dr. Kendili's explanation and my summation. In your field of climate restoration and mitigation, how do you see this working? Could it work for you? Could it? What can we take from her approach?
Thank you, Richard, and thank you, everyone, for having me. Certainly, there are a lot of similarities between the COVID pandemic and the current climate emergency. There's certainly been a lot of op-eds, articles, studies that have suggested as much. We've heard it already from Dr. Kendili. Generally speaking, the Harm Reduction Manifesto, as written for public health, has several applications for today's climate crisis. First, this is a crisis, an issue that affects everyone. Though we know that the world is not binary and context do matter. A global South country certainly lacks the same resources and opportunities to mitigate and adapt and restore the climate, versus the West, where not only do they have the resources, but are also the leading emitters since the beginning of the Industrial Revolution, so have a responsibility to lead and a responsibility to take action. And of course, as individuals, it really does depend on where you are and the context, by which to make your consumer choices or your daily choices. So socioeconomics play a role as well. With this in mind, the one other piece that really jumped out to me in working in climate is that it's going to take all stakeholders to take a collective action to do their part. Global companies can make decisions to avoid harming the planet through their procurement and corporate policies and investments, Governments have to apply the urgent actions that are laid out in the Paris Climate Accords and ensure a reversal of the most consequential impacts, both at national and local levels. And then, as I mentioned earlier, individuals, of course, have a role to make choices that benefit the planet and should continue to do so. As mentioned repeatedly, and I'll mention it again, I think similarly, there are no silver bullets or miracle solutions here. It's going to take everyone to part and inputs to play a role. In terms of differences, I think one of the biggest differences in the climate space versus what I've heard thus far on harm reduction is simply time. I think we might have time to prepare and analyze how best to respond to the next global pandemic based on learnings that we've acquired here. We've spent the last 30 years reflecting on climate. Now is the time for action. The climate emergency is here. The polar ice caps are melting. Extreme weather events are occurring daily. Biodiversity and wildlife are dwindling across the planet. So we just don't have that same time for reflection.
So what I'm hearing is that we need an all of the above approach with multiple stakeholders, as many as possible at the table, and that while we might have time to reflect before the next pandemic, we don't have time to reflect for climate. We really need to take action now, and we can't afford to alienate or push people away at this time. We need to really draw more actors to the table.
The one challenge that we face in the climate decarbonization narrative is just a definition of terms. There's direct air capture that actually deals with legacy carbon and pulling that out of the atmosphere. That's what we as an organization are backing, is scientifically tested and researched opportunities to safely remove and store carbon from the atmosphere. Decarbonization in terms of sort of capturing that carbon at source, in many ways does provide license for fossil fuel companies to operate as they have continually. So in that sense, it's an awareness and an understanding that, not all solutions are created equal. Again, no silver bullet and no miracle solutions here, but it's an awareness and an education of what those opportunities are, the negative ramifications of some solutions that are out there and gaining traction, and really mobilizing around that through language and actions as laid out in something like the Paris Climate Agreement.
So what I'm hearing from that is that not all solutions are created equal. We do need to take scientifically backed and proven approaches, but when we're dealing with problems that have multiple possible causes, we need to explore multiple possible solutions, and we need to raise awareness of people at all levels about the availability of these solutions and their viability, as well as the scientific evidence behind them.
Exactly right. Thank you, Richard.
Thanks, Kai. Lieutenant Goldstein, I want to pull you in. Diane Goldstein, in addition to being a retired police lieutenant for the Redondo Beach Police Department, you now serve as the executive director of the Law Enforcement Action Partnership, a network of police, prosecutors, judges, corrections officials, and other law enforcement officials advocating for criminal justice and drug policy reform. I know harm reduction has been applied for a while in the world of addressing crime in the field of criminology. What's working? What's not working?
Well, you know, harm reduction introduced into policing really is about saving people's lives in a variety of different ways. And I'm going to be really specific and on topic relative to the issues of how harm reduction can benefit community health and safety. You know, we know as law enforcement professionals, not just in the United States, but across the world, that we've recognized we cannot rely solely on arrest in the criminal justice system as a means to address a substance use disorder, really epidemic, which has now become endemic. If you look at in the United States, we've lost over 100,000 people last year. Saving lives and reducing the crime and disorder caused by underlying problematic drug use is not mutually exclusive, and we've treated it as it has been. So a response that can achieve both ends really requires a significant paradigm shift in criminal justice professionals towards what harm reduction brings, which is a evidence-based practice that closely links public health and law enforcement strategies with their most important outcomes, which is about reducing morbidity and mortality. And when we do these things, when we introduce smart on crime harm reduction interventions, that includes things like a safe supply of drugs. This is not an outlier. You know, heroin assisted treatment has been in existence in Switzerland for years and in other countries. In 2020, the Canadian Police Chiefs Association, not known for their liberal tendencies, recommended that both safe supply, expanded harm reduction services, plus full decriminalization of all drugs with interventions that include treatment on demand, overdose prevention centers, drug testing, be incorporated into the public health strategies. And so what harm reduction has done for law enforcement in the last few years really has been about introducing evidence-based practices, but it's also making us take a look at kind of the philosophical viewpoint of, you know, what's our role? I have long stated that, you know, law enforcement has a great code of ethics, but it really needs to be blown up and reimagined and transformed almost into a criminal justice Hippocratic code of ethics where we do the least harms. And the most important thing about that is that harm reductions policies reduce the harms of the criminal justice system by adopting interventions that really view public safety from a community health and safety and puts people who are suffering from substance use disorder or drug users who don't have problematic abuse issues as a partner to ensure that the whole entire community is safe.
Fantastic. So what I'm pulling out from that, Lieutenant, is that as I said originally, we need to think about things that are becoming increasingly endemic or inherent to the human condition. We can't eliminate crime. We can't eliminate addiction. The industrialization is not going to be eliminated tomorrow. These are things we have to manage and figure out how to be, I like your term, smart on crime, as opposed to hard on crime or soft on crime. We want to be smart on crime. We need to be smart on climate. And we need to be smart on things like combating the COVID crisis. I wonder how you respond, though, to people who might say, that it is being soft on crime versus being smart on crime? How is this not being soft on criminals?
Well, I think one of the things that you can look at is, what are the metrics of how we should be judging how safe our communities is? And one of those metrics is the absence of crime, right? And so we know there is empirical evidence out of Switzerland, in particular around the issues of heroin-assisted treatment programs, that people who've suffered from chronic substance use disorder, when given the opportunities to engage in a medically prescribed program monitored by health officials, not by cops, mind you, that crime went down, welfare went down, people were integrated back into their families and their communities. And so when you look at things like safe supply, we can easily, accessibly give people a safe supply of drugs to prevent the poisoning that's being caused by the illicit drug market. Let's be very clear, the deaths in our country are because of the illicit drug market, primarily because of fentanyl toxic poisoning. A safe supply of drugs, a pill, will cost 33 cents and prevent someone who's breaking into your house, breaking into your car, or robbing the gas station owner to get money to buy their drug from preventing that crime. And isn't that not just a conservative, smart fiscal message about what works versus churning the system and continuing to spend trillions of dollars that we know don't work, and in fact sending people through the criminal justice system makes their substance use disorder worse and actually just teaches people how to be better criminals, to be quite frank.
Yeah, so we need to not just look at the drug crime itself in isolation, but to look at the entire system, which includes the crimes that are committed in order to access and get access to the illicit drugs, as well as the deaths that are caused by using unsafe supply, and really consider the holistic welfare of the community and consider making trade-offs. Like, as you say, it might be better off from the community's point of view to provide safe supply, bring down violent crimes, and bring down the overall death rate caused by illicit use, and bring up overall community welfare.
Absolutely. And you brought up a really, really critical and important point, is that, with human nature, we are never going to eliminate substance use disorder. We are never going to eliminate crime. Our role as policymakers is to implement policies that mitigate the harms to not just individuals, but to all our communities. And what better way of doing it than linking overall health and safety? And we don't do that. We operate in silos, and we need to stop that.
I appreciate that, Lieutenant. I want to come to our last panelist, Mazen Saleh. But before I come to you, Mazen, I want to go back, Kai, to you for a second, because it occurred to me when the Lieutenant was just talking about what are we focusing on? What are we really fighting? When I look at a lot of the pro-climate policies right now, they're looking to eliminate carbon or to eliminate fossil fuels, versus like really looking at how are we going to create a holistic solution that would potentially remove carbon from our atmosphere and resolve the climate crisis without necessarily demonizing a specific fuel or trying to maybe spend unnecessary time chasing a rabbit that we might never be able to catch. Am I onto something there, or am I off track?
I guess I'm not quite sure what the question is there.
My question is a lot of current policies, a lot of current climate policies seem focused on the elimination of fossil fuels. And I would maybe analogize that to the Lieutenant's point about focusing only on drug use or illicit drug use and not really considering the whole system about what are you trying to accomplish. If the goal is to try to make a more sustainable economy, is it right to just focus on fossil fuels exclusively, or should we be looking at more holistic solutions?
Yeah, I think that's right. We should be looking at more holistic solutions. First off, I don't know that there's any policies that are eliminating fossil fuels. That's just not quite there. But I think Richard, what you're saying is, because there's not that shift, we do need to look more holistically. The Department of Energy just put out a significant announcement for investment in research in direct air capture and job creation in alternative sustainable energy resources, and conversations around ways to, I think we're now at a place where there's an understanding that we will never, similarly to crime, we're never going to eliminate fossil fuels or carbon emissions into the atmosphere, but there's ways to mitigate. There's ways to find other alternative resources, energy resources and power that are safe. Research needs to be done, testing. There's solutions in the oceans that have yet to be untapped. There's reforestation and kelp. So there is a lot happening, I think, in very similar ways to what Lieutenant Goldstein mentioned. I think it's very similar in that it is a mitigation and adaptation world in which we're living in for the climate crisis, and not an eradication or elimination of, in her case, crime, in my case, carbon emissions.
Excellent. Thank you, Kai. Mazen, before I come to you, just one last reminder for our audience. If you are having trouble hearing us when we go to talk to Dr. Kendili in a moment, you can join the English channel. You can do that by mousing down to the bottom of your screen and selecting the English channel. Dr. Kendili will be speaking in French. The rest of us are obviously speaking in English, but if you do need to access the English translation, that is where it's available. I also do want to point out, you can join our conversation online by following us at Collaborate Up. That's all one word, at Collaborate Up, or the hashtag practical, not magical. Again, that's on Twitter, the hashtag practical, not magical. Mazen, finally coming to you. Sorry about the delay. You are the policy director for integrated harm reduction at the R Street Institute, and you've seen harm reduction applied to a number of fields. What's the Institute's perspective on harm reduction, both here in the United States as well as abroad?
Yeah, I mean, harm reduction at its foundation really recognizes that strategies that traditionally emphasize abstinence or behavior avoidance, while they may work for some individuals, they are actually quite ineffective at the population level. So at R Street Institute, we believe that health policy that's grounded in harm reduction has a potential to really dramatically reduce the negative consequences associated with various behaviors, both legal and illegal. We know harm reduction got its start in substance use and sexual health, but we actually look to an expanded definition of harm reduction. We embrace and promote all areas, including cannabis, tobacco, alcohol, drugs, and sexual health. And we think that if you support harm reduction for one risky behavior, you should support it for all. I think if the COVID pandemic has really taught us anything, it is that each person has a unique risk profile, things they are willing to do based on trade-offs of personal decision-making. And so this extends to everything from seatbelts to helmets to mask wearing, or to calling a taxi if having a couple drinks out at dinner. But this also includes reduced risk tobacco. What we tend to find is the higher the risk, the more charged the conversation. In reviewing the Harm Reduction Manifesto, Professor Toufiq really eloquently wrote that while progress has been achieved over decades of struggle between repressive, punitive, and moralizing approaches, and in the United States, we're not immune to having these histories as well. Diane's presentation is illuminating in the sense of vilifying those with addiction and trying to incarcerate the problem away. And while the intentions of governments both here and abroad may be noble in addressing drug use and other risky behaviors, the first point of action should be a realization that silver bullet solutions do not exist. Richard, kind of your comment at the top of the conversation here around those one-size-fits-all solutions. As a result, we find the positioning in the United States politically is increasingly partisan. We know those on the political left end of the spectrum tend to support opioid harm reduction and comprehensive sexual health education. And you have the inverse relationship with those on the political right who instead promote tobacco harm reduction, but not the others. And so usually what we tend to find is a first line of defense here of policymakers often attempting prohibition completely. But history has shown us time and again that prohibition doesn't work. We've seen that from the folly of alcohol prohibition, and we know that the war on drugs has been an abject failure in the US. It has not reduced the nation's drug supply. It has not made it safer. It has not reduced the number of overdose deaths, which have peaked last year to numbers that are the highest they've ever been since the count was started. And we see the war on vaping as a contemporary phenomena, an extension of this. Though the Federal Food and Drug Administration has a stringent regulatory review for reduced risk tobacco products, it actually approved the marketing of a class of vapes that are beneficial to the protection of public health, but state governments are moving to ban them entirely. Regardless of kind of what approach is taken, the individual tends to bear the brunt of bad public policy, whether it's regressive taxation for reduced risk tobacco products or incarceration without access to treatment for those that suffer with substance use disorder. So at our Street Institute, we really take an integrated approach to harm reduction in the sense that we try and promote making reduced risk tobacco products more widely available for adults who can't or won't abstain from smoking deadly combustible cigarettes. Looking to expand access to syringe service programs for people who inject drugs, educating on the merits of comprehensive sexuality education as opposed to abstinence only. And essentially all of these things kind of integrate at the individual level, right? Because individuals might have various behaviors that they are performing in simultaneously. But we think that individuals are probably best equipped when they have the information and tools to protect their health. And so in that way, we think that evidence-based harm reduction services enable communities to keep themselves safer. Of course, operating with the acknowledgement that to err is human, right? So we're not going to fix our way out of the human condition. So how do we adapt?
Yeah, that's fantastic, Mazen. Thank you. And I'm fascinated by this dichotomy you point out, or maybe a contrast that on in the United States anyway, on the political left, we see acceptance of harm reduction approaches on sexual health and drug use, but not on climate or carbon or tobacco use, and particularly lower risk tobacco products as an example of that. Thoughts on why that is, like, or how do we reconcile that? How do we move, kind of come out of the deadlock on these issues?
Yeah, I will say if I had the right answer to that, I would definitely be promoting it more. I think my hunch rests along a couple things. One is addressing misinformation in the public sphere. We see this in the effectiveness of vaccines and mask wearing and other kind of harm reduction measures for the COVID pandemic, that it doesn't need to be a partisan issue. It's just getting the right information out and clarifying any misconceptions, I think is a pretty large thing. Wanted to open it up to Kai for the environmental angle.
Sure, Mazen, I think you said it well. If I may jump in, Richard, you said it well. Misinformation, education, and awareness is so critical to how we're going to move forward as a society. Ultimately, I think what I'm hearing from all of my colleagues here is that ultimately the way it's being acted upon in different contexts and different communities, policies, et cetera, vary based on local realities. But we really just need, broad-based education, awareness, and understanding of the opportunities that we have ahead of us.
I may add one more thing to those as well, is a bit of open-mindedness, particularly at the individual level, to some of these components of do lesser harm, right, are a little counterintuitive, especially to medical providers, right, who do no harm whatsoever. But in an imperfect world where harm exists, it's just how do you manage that harm a bit better, right, than trying to completely protect people from it wholesale.
Bon, ça coupe, mais heureusement, j'ai compris le sens.
I couldn't hear very well, but I understood it basically. So I would like to thank all of my friends for their open-mindedness and for their interventions. When we talk about healthcare and health, we always talk about fighting addictions, fighting STDs, fighting tobacco, fighting pollution. But the reality is that we need to stop fighting and we need to start managing and living with human behaviors that are here and they're a part of human beings. Now, having these human beings to having a better behavior, not perfect, because otherwise we won't have any hospitals, no pollution today, no global warming. We wouldn't have all these things. There's an openness, open-mindedness that we need to have that needs to be adapted to the realities on the field. There's no magic, because although we set up programs against, for example, against crime, against drugs, against pollution, for the implementation of mandatory or compulsory health insurance. But the reality is that there's a gap. there's a gap between the way of thinking and deciding and implementing programs and their actual implementation and the reality on the field, which is based and dependent on human beings. So at this point, I think that we need to stop. Prohibition doesn't work in a lot of fields. And so since it doesn't work, what can we set up? And we need to leverage this experience. The pandemic has shown that there's a life before, a world before, and a world after COVID. And so we need to think through certain things. It's not everything that needs to be technological. It's not everything in terms of material matters that will make us move forward in terms of public health policies. It's an accountability, a responsibility to say, okay, this doesn't work this way. Ideals don't work. So what can we do to reduce risks in terms of behaviors, in terms of addictions? And we're already doing this for drugs, for example, and not only for marginalized people. We have things that start in Africa, but we know that they're already very present. For example, some prescriptions from the 1970s and 80s for painkillers in the United States mean that today it's a health problem today. Painkillers are a health problem in the United States, but for us, we are beginning with painkillers. So Africa needs to leverage on the experience of other people in other countries that are coming to Africa today. So we need to leverage the human experience. This needs to be shared. We don't have to repeat the same mistakes and continue to set up rigid programs to fight some things where others can help us to set up certain things, and we can exchange amongst the different continents to set up sustainable, real, adapted health policies around the world, because human beings are weak. They have some behaviors. We cannot live without cars today. We cannot live without having sexual relationships today. We cannot live without certain kinds of addictions, sugar, tobacco, coffee, or anything else. It doesn't necessarily have to be something that gives some marginal behavior, but we need to think about things that are adapted to the lives of human beings today, and we need to stop fighting human behavior with respect to health across the planet.
The thing that my organization talks about with law enforcement a lot is that, you know, we want to make your jobs easier and better and safer. So a harm reduction tactic that's been used for years is syringe exchange services as the perfectly clear example. And the reduction in workman comp injuries to police officers when there is a syringe exchange program has been proven. And so I think you have to couch messages based on the self-interest of that particular group or organization in many aspects. Is the conservative fiscal issue is really important to center right politicians. It's coming back and saying, you know, what's the cost associated with criminalizing someone for simple possession of drugs? I will tell you, in California, is we spend over $100,000 a year on sending an offender to state prison. That's $100,000. That's a University of Southern California education with books, housing, and meals, and plenty of money left for a kid to spend. So, you know, do we want to invest in systems up front or on the tail end? Right now, we invest in systems on the tail end, and that's the problem. We are at the, you know, the tail wagging the dog versus being reactive and looking at science on how best to solve problems of human nature.
You know, it occurs to me, I mean, what you're discussing here is bringing, you know, economic trade-offs into the picture and thinking about how do we choose policies based on which ones will produce the intended effect in a cost-effective way.
Especially, you know, we've had this pretty significant violence uptick in the United States for a variety of different purposes. and reasons, and not purposes, but reasons. And so, I always go back to legislators and staffers at the local, state, and federal level is what is the purpose of policy and governance? And how should we, what is government's role? And government's role is to save people's lives and to protect their rights. And so I think that there's ways of selling that message to say, the work that you're doing is not soft on crime. It's actually smart on crime, because by introducing harm reduction interventions, we save police officers' lives. We're not sending cops into no-knock warrants and having the potential for them being killed or killing someone like we did with Breonna Taylor. What's the political cost of the deaths of our citizens from needless law enforcement shootings? And so, it's complicated. And I think, with the help of organizations like R Street and other harm reduction organizations and drug policy, we've made a lot of changes. And I think we're going to continue to do so. And I think it's going to make both our citizens safer, and it's going to make our police officers safer, because I don't want to see any more police officers lost in shootings as well.
Mazen, I'd like to come to you. Do you have experience at the R Street Institute with trying to navigate this, the potential political minefield of trying to make cost trade-offs on public policies?
Yes, we do. I think, as a nonpartisan think tank in Washington, D.C., many organizations like ours also have to walk the fine line, right? Because we are coming up against kind of dogma, ideology, and political affiliation. The thing about the negative consequences with risky behaviors is they don't really care whether you are a Republican or a Democrat, or whether you have money or don't have money. Nobody is immune to potential negative consequences from any type of risky behavior. And so really the key is to identify what the value propositions of those conversations are, right? Whether it is the cost effectiveness of syringe service programs, right? Reducing the number of individuals who get hepatitis or HIV from sharing needles, which also have a massive healthcare cost, right? Because those individuals tend to be underinsured or not insured at all. So whether it's the cost effectiveness of certain interventions, or whether it is securing individual freedom and autonomy, right? So putting the power back into the hands of individual citizens to be kind of their patient citizens, patient advocates, as our colleagues across the pond were talking about, and really equipping them with the tools and the information to make the appropriate decisions to protect their health, right? And I think that there's both a conservative case and a liberal or a progressive case to be made for these things. And so really a lot of our work is around making harm reduction apolitical, because again, the consequences are immune to our politics. Yeah, so I think the primary piece of trying to make it apolitical is showing policymakers what is going on in their state, right? Who all is affected, what their constituency is dealing with and suffering from. And then showing other alternatives, right, than either complete prohibition or incarceration or some of these heavy-handed kind of interventions that have been proven time and time again to be ineffective. And so I think that one doesn't need to look much further than the opioid epidemic to say all of the things that we have put into place. If incarceration was the answer to these things, we would not be in an opioid epidemic, right? And so what are some alternatives that we can explore? And it's going to, back to some of the original comments, it's going to take some open-mindedness, and it's going to take some leadership really to push forward and try and push forward on some of these items that have historically been kind of political minds.
What is one thing that I, as a consumer, or if I'm a participant listening in on this webinar, what is one thing that I can do when it comes to reducing harm or taking a harm reduction mindset? Is it something I do personally? Is it calling my congressman or my legislator? What can I, listening in today, do? And Mazen, I'm going to stick with you. First bite at this question.
Yeah, so I think there's a few things. So one is to to educate yourself as a patient citizen. And of course, there's no shortage of information that's out there. And so trying to navigate the appropriate and correct information, of course, is a challenge in and of itself. And the other one is to get engaged, particularly in the United States. I think people, I think citizens in the US underestimate some of the impact that they can have on local elections and state legislation and things like that. So make your voice heard, attend hearings, things like that, because these are essentially your communities, right? And so as being a responsible citizen, you have to engage in the protection of your communities. And so, you know, when there's legislation that comes out of, you know, shutting down syringe service programs or making them harder to access, or completely eliminating, you know, vape or reduced risk tobacco products in a state, definitely stand up, make your voice heard after that education bit, because I think there's a lot of power in that.
Excellent. So educate yourself as a citizen patient, as a citizen consumer, get engaged and make your voice heard, especially locally. Lieutenant Goldstein, your thoughts?
Everything that Mazen said, and then critically find an organization in your community that can help you advocate. Probably some of the most powerful times I've had with legislators is not coming in with me, but coming in with a mom whose son died from a overdose, or who was sent to prison for a low-level drug offense, because people need to hear, legislators and staffers need to hear those personal stories.
You know, we started just 4 years ago as an organization with this view of, you know, starting at the top, working with national leaders across the world, working with the UN to try to implement policies that deal with direct air capture and carbon removal. And we heard time and time again is we need proof that this works. We need proof that constituents are demanding this. So start working at the local community. Also, you can get policies and legislation in place that support your vision. So that's what we've done. And it's been tremendously effective, hearing from people in their community, getting them to motivate and push the legislators to have policy that support climate restoration. One that we're really pushing here in the States is, you know, have your local legislator, whether it's state or local, include low carbon procurement in their building materials procurement policies. Look at low carbon concrete and you know, other infrastructure, large scale infrastructure building projects that you have. Consider using this these options that are out there and available that not only, you know, pull carbon from the atmosphere, but actually could you know, be an answer and be a model for others to follow.
So previously, I will speak very quickly. Scientists used to do a bit of everything. They could be philosophers, painters, writers, physicians. Leonardo da Vinci was a proof of this. Today, we need to all meet together, because since earlier we've been talking about crime. Crime and drugs are related. Crime, unemployment, precariousness are linked. Health is linked to things that are social in nature, as well as economic in nature, organic health, and psychological health. Because drug consumption, even when it's legal in some countries or some states, let's not forget, and I will talk about cannabis that now is not on the drug list anymore, but given the various studies that have been published since the 1950s, THC gives more action. Consumption of THC, you have a weapon and you're allowed to carry a weapon in a state, so more crime. So unemployment, precariousness, crime. So harm reduction can bring together all of these words, all of the different words of society through a shared work of experts. It concerns the economy of countries, unemployment, civil society as a whole. It concerns states and governments. But before making decisions, we need to look at human beings from a holistic point of view. And today, we are always dividing. I'm a psychiatrist, and I can say that there's a psychiatry everywhere, in cardiology, in neurology, and oncology. And so today we cannot eradicate things. We need to address them from a real point of view. And this manifesto, this harm reduction manifesto, is an openness to be able to start working together towards global public health policies that address the different society's evils. Addictions, yes, STDs, non-transmissible diseases, non-communicable diseases, cancers, economy, healthcare, poverty, unemployment, etc., in a human impetus, because the pandemic is teaching us today more than ever to have a more human approach and to address health under various angles together.
Fantastic. Thank you, Dr. Kendili. Thank you, Kai Young at the Climate Restoration Foundation. Thank you, Diane Goldstein from the Law Enforcement Action Partnership, and Mazen Saleh from the R Street Institute. We are so grateful for all of your contributions today. Folks, I think what we've heard today is that when we're dealing with endemic problems, things that are inherent to the human condition, whether it's disease or addiction or industrialization, we really need to take a basket of approaches, an integrated look and a risk managed look, and not look to ban or try to eliminate things that really can't be eliminated, and instead try to look at how we can manage them and improve the conditions of our communities and our own individual health. With that, I'm going to close our webinar for today with a special thanks to our partners here at the Washington Times and the generous support of Philip Morris International for their fantastic contributions to making this all possible. Thank you all. Have a great day.